This video is for the Phalens test. The scientific explanation of this technique is as follows. The Phalens test is one of many tests that is used to help diagnose patients with carpal tunnel syndrome. According to a study by Khan, Sharifat, and Ali in 2013, carpal tunnel syndrome is the most common compressive entrapment neuropathy and has a general prevalence in the United States of 2.7%. and is more common in females compared to males. Carpal tunnel syndrome is considered a compressive entrapment neuropathy of the median nerve as it passes through the carpal tunnel. Diagnosis of carpal tunnel syndrome is done through a variety of provocative tests and measures. According to Katz et al. In 1990, the Phalens test reported a sensitivity of 75% and a specificity of 47% for carpal tunnel syndrome, making it of moderately acceptable clinical use. The premise of the Phalens test is that the wrist is placed in the maximally flexed position in order to increase the pressure in the carpal tunnel and places increased pressure on the median nerve as it is squeezed between the transverse carpal ligament and the anterior margin of the distal end of the radius. To explain this technique in layman's terms, this technique is used to see whether or not the tunnel in which the nerve that controls some of the hand movements and gives feeling to parts of the hand is large enough, or whether the walls are slowly caving in, blocking some of the necessary information. If the tunnel is big enough, it should not matter what position the hand is in, the necessary information should reach the hand. If the tunnel is beginning to get smaller, when the back of the hands are pressed together and held, some of this information does not get to where it should, and tingling and numbness is felt in the palm of the hand, the thumb, the index and middle finger, and half of the ring finger, and the tips of these same fingers on the side of the finger with the nail on it. The step-by-step instructions for this technique are as follows. The first step is to have the patient sit comfortably with their elbows flexed and the wrists in maximal flexion such that the dorsal surface of the hands are touching and the fingers are pointing towards the ground. Next, you will have the patient actively push into their hands to maintain maximal flexion. You will hold this test for at least 1 minute. A positive test is indicated when the patient experiences any numbness or tingling in the median nerve distribution of the hand within the first 45 seconds. I will now have the patient perform the technique. Alright, we're going to go ahead and bring your arms up. Keep it at maximal flexion. I want you to just hold this for as long as you can.
There's tingling.
All right. So this indicates a positive test and may be indicative of a potential entrapment of the median. The scientific explanation of the reverse Phalens test is as follows. The reverse Phalens test is a variation of the Phalens test and is performed for the same reason, to increase the hydrostatic pressure in the carpal tunnel. According to Werner et al., the reverse Phalens is more effective at increasing hydrostatic pressure in the carpal tunnel than the traditional Phalens test. However, Crom et al. Reported a sensitivity of 41% and a specificity of 55%, making the reverse Phalens test of minimal clinical usefulness. To explain in layman's terms, as the reverse Phalens test will follow the Phalens test, I would just say this is another position we can use to get the same information as the Phalens test. The step-by-step instructions for the Phalens test are as follows. Step 1, have the patient sit on the edge of a treatment table and place the palms of their hands together and push into maximal wrist and finger extension. The patient will then hold this for up to 2 minutes. A positive test is considered the same as the Phalens test in that numbness and tingling will present within the median nerve distribution of the hand within 45 seconds.